Okay, so good morning.
Good morning.
Thank you for meeting with me today. Can you let us know your name and your profession?
My name is Jennifer Lefner. I'm a family nurse practitioner. I've been doing this for about 10 years now, almost 10 years. And before that, I was a registered nurse and I worked in labor and delivery for about 7 years.
Wonderful. Can you tell us what is the most rewarding, thing about working in healthcare for you?
Well, the most rewarding thing is helping people, and I've always known I wanted to do that since a very early age. When I first started my career as a nurse practitioner, I worked in traditional medicine, and I did a lot of disease management, which I thought at the time was rewarding because I would be able to diagnose patients with diseases, and then I would be able to help them overcome them, or I would help treat them and keep them healthy and well, what I thought. Now I work in functional medicine, which is a little bit different, and it's way more rewarding. What I do is I help to figure out what's wrong with somebody before the disease even occurs. So I work on this side of disease and help to prevent versus the other side. So what's nice about that is I'm able to really help people genuinely because I'm keeping them off of medications, I'm keeping them out of the hospital, and I'm helping them figure out something that they may have not known was going to come for years and years and years. And I'm able to help them not get that disease or have that ailment or be able to I'm helping them not to be on 13 medications.
I think that's wonderful because preventative medicine, I think, being able to do that for somebody is, like you said, not allowing them or helping them stay away from medications, which in long term can cause secondary issues.
Absolutely.
So I think that's amazing what you're doing.
Thank you.
Another question I have for you is, do you recall, I suppose, a moment in your career where you had an unfavorable situation or circumstance happen with a patient or patient family?
Yes, I have one patient in particular. We'll call her Mrs. R. And this is unfavorable and favorable, because what happened is she was having horrible issues with sleep. She was taking all kinds of sleep medication, and one day she fell and she hit the back of her neck on the bathtub. So she actually ended up becoming a quadriplegic from that. So she was paralyzed from the neck down. And she was at Warm Springs Rehab. She was rehabbing. She was seeing doctors and being treated, and just a very, very sad situation because they told her she would never be able to walk again. Prior to that happening to her, though, I had been working with her on this side of medicine, right, of functional medicine, and I had been finding vitamin deficiencies. I had been finding deficiencies in certain vitamins and things that would protect her, right, from neurological diseases and things like that. So I'd already had her set up for protecting her body, right, so to speak.
Right.
Protecting her cells, protecting her on a cellular level, protecting those nerves and things. So when she fell and she ended up becoming quadriplegic from the neck down, she actually ended up rehabbing very well, and she is one of the only walking quadriplegics out there. So what happened was, of course, I always believe in the power of prayer, right? So power of prayer, but also she had amazing doctors, rehab nurses, therapists. But I feel like had we not set her up for finding out on a cellular level what was wrong with her, and helping her to do that, she wouldn't have been able to overcome it so well. So unfavorable because she was paralyzed for a while, but then she was able to walk out of that rehab center, just to walk out. So now she uses an assistive device to walk, but she's not in a wheelchair.
That is amazing. And I love to hear those kind of stories because they're almost like a miracle.
Yeah.
But again, like you say, there's a lot of work to be done before.
Absolutely.
And kind of protecting yourself before something happens. I think that's so wonderful.
Yeah.
Wonderful. And another question I have for you is, how would you describe your relationships with your patients? So how do you establish them? How are you able to continue them? And in the case that you do feel perhaps that you cannot deliver a certain service to somebody, maybe your views are different, things like that. As a healthcare professional, and you've been working in medicine for quite some time, how would you describe that?
Sure. So I always treat my patients like they're my family. So when I walk into a room and I knock on that door and I go inside and I introduce myself to somebody, I always think to myself, what would you do if that was your mom, your grandma, your dad, your brother, anybody? So that's the first thing, is that I practice medicine up here, but I also practice it from my heart. And so when I walk in the room, I tell my patients that I'm going to treat them like family. And the next thing that I feel like I do that's very trustworthy is I don't ever tell somebody what they want to hear, and I don't ever tell them an answer that's not true. If I don't know the answer to something, I seek it. So what's real important to keep the trust of your patients is that you help them to the best of your ability and recognize when to say, I don't know what to do next. And that's where you either send them off to a specialist, maybe to somebody else in the practice that may have more knowledge on that topic. That's when you do that. But you always treat people like they're your family, and you help them. You look at them and you think, I want to keep this person healthy. I want to keep this person well. Not I want to just help them when they're sick or when they've got a disease or a diagnosis. I want to prevent that from ever happening to them. And so when you practice medicine that way, then you're actually practicing medicine, right? So you're helping them to stay healthy.
I think that's wonderful. And it's so important, like you said, to treat them like family members.
Oh, yeah.
I think that gives you that kind of, I guess, opens a door for them to trust you and believe in what you're doing.
And I'll give you an example too, and this might not pertain so much in the recent years, but I remember when I was working in labor and delivery, and I had a patient who was, I think she was Muslim, if I'm not mistaken, and she came in to deliver her baby on a weekend, and her doctor, who was a female, right, because they can't be examined by a male doctor, she was off. She wasn't on that weekend, so the only doctor for her group was a male doctor. And it was very disturbing to the patient and the husband and the family, so much so that they were crying. And the husband begged me to deliver that baby because he was like, I can't have a male doctor see my wife in that capacity.
Yeah.
And okay, I can't deliver this baby, so I thought, what am I going to do? So I called every doctor on call for that hospital that was a female and asked them if they would deliver this baby. And it turned out to have a really good outcome, but I felt like I did everything I could that was in my scope of practice, that was ethical, to try to help this family with that. And it's the same thing as being a nurse practitioner, you know. I try to always keep cultural concerns, ethical concerns. I always make sure that I help patients and I understand that and I know that what's important to them and what they, you know, what they need. I try to meet their needs, and because a lot of times patients, especially in San Antonio, you have a large Hispanic population, so you also want to make sure that you're being, I don't know what the word is, but you're paying attention to that, and you're making sure that because that's important to people when you help them, is that you take into account their cultural aspects, ethical aspects, and not just, you know.
Right, that's so important.
So it gives individualized care.
Yeah, of course. I know in our readings we talked a lot about, you know, abortion and how that's a really big topic. Yes. And in fact, I came across another topic about pharmacists sometimes, you know, feeling like they cannot dispense a birth control or contraceptive medication because they personally, you know, do not believe that. Being in the healthcare field that you are, how do you deal with those kind of struggles?
Well, I feel like, first of all, it's not my place to judge. And I got into medicine to not judge and to treat everybody individually. If I don't have strong ethical concerns with that. If I did, I would certainly just refer them off to somebody. Okay. But I always feel like, you know, like if a female comes in and she wants to have an abortion and she seeks my advice on that, well, my advice is to first do no harm and to make sure that she's taken care of and that she feels comfortable. So it's referring her not just to a clinic that might provide that service to her, but also making sure she's counseled correctly, making sure she's seen a counselor and seeking those services that help her to make that decision, make sure that's exactly what she wants to do because that's her decision ultimately, you know. Then there's other aspects of abortion too. There's therapeutic, there's medical, there's, you know, choice and things like that. So same thing, you know, I can't come from a strong Catholic background, but I also believe that medicine, you know, I have to put that first sometimes before I can put my religion first because, you know, I want patients to know that they're being taken care of and that they have choices and it's their right and things like that. So, but if I had an ethical concern with anything, then I would defer them to somebody who could help them, but making sure that they were taken care of in all aspects.
Great. I think that's wonderful that you think that way, and it's so important, like you said, for people to feel comfortable.
Absolutely.
And not judged, because we never know what kind of circumstance they're in.
Nobody knows.
Yeah, so that's wonderful. Yeah. And then another question I have for you is if there's, I know you've worked in healthcare for quite some time, so I'm sure you've encountered a lot of frustrations for different reasons.
Yeah.
What would you say is your biggest frustration? And I guess it could just be currently, at the moment, because there could be a lot of things. And what do you think, the healthcare community can do to make those improvements?
I feel like my biggest frustration right now, and I just had this conversation with my husband last night, is insurance. They're my biggest frustration right now because they are dictating a lot of what we can do to help the patients. Mm-hmm. So when I see a patient in my clinic and I'm, trying to help them and I need to order certain procedures or services on them, I'm being stopped by insurances because they don't want to cover certain procedures mm-hmm. and certain costs. They also are not reimbursing like they used to. So they're making it very hard for clinics to survive. They're making it very hard for the doctor, the nurse practitioner, the PA who wants to help their patients and really work with them. They want us to see patients in 10 minutes because a lot of our peers, that's how quickly they see them. They want us to give medications, look at lab work, interpret them, look at an image, interpret it, give medications and leave and not spend time with the patient. Mm-hmm. And so we're being punished for that. And so, and that's very sad. So my biggest problem right now is insurance companies not allowing me to practice medicine, mm-hmm. having to rely on them to tell me what I can and can't do for a patient, which is so wrong.
Right. Wonderful. And what do you think we can do as a healthcare community? I know providers are very busy and, you're there to investigate and treat and diagnose patients successfully. What can the administrative side do? Being that you work in a clinic, I'm sure there's a lot of administrative issues that may arise at times. Mm-hmm. What is one in specific that you can, point out within your experience in healthcare?
I'm trying to think.
We're perfect. I'm just kidding.
I'm like, you guys don't have any problems.
I'm joking.
I think the biggest thing is that when you're learning about healthcare administration, I think something that's super important and that's admirable I've worked in various clinics, is that when the healthcare administration has medical experience. So I'll give you an example. I worked at a clinic before where the COO of the clinic actually started from the bottom and was a medical assistant and worked her way up to becoming the COO of this clinic. And what was nice about that was that she could step in, she understood, and I think she was able to help in all aspects because she had that medical knowledge and that medical background. It wasn't just the business background part of it. And I think that makes a big difference and speaks volumes for clinics when you have people who have more of that well-rounded experience. Same thing for doctors, same thing when doctors and nurse practitioners have the opposite side of it. Mm-hmm. When they have the business side of it, they don't teach us nurse practitioners, I don't believe they teach doctors either, physicians, the administration part of medicine. And I think that's so important. So something that could change would be requirements for in the school systems, at the universities and the colleges to have some type of healthcare administration incorporated with the curriculum. And then on the flip side too, I'm sure you can't have every healthcare administrative person who has medical background, but somehow incorporate something where they have to do some type of internship or something, just to kind of give them a better feel of how clinics work. And maybe they do that.
I sure hope they do.
Yeah.
Well, thank you so much, Nurse Practitioner Lefner, for meeting with me today.
You're welcome.
I'm very excited to share this with the class and the course. I wish you a successful day and a blessed week.
Thank you. I appreciate it. Thank you.